Right after my husband's heart attack, his doctors told us that he still has severe arterial blockage and that he might need bypass surgery. Now, this was a shock to us. Bypass surgery? What? Why? How? He was fine till yesterday. It took me a lot of research and conversations with doctors, family, friends, and people from medicine and cardiology to understand what goes into that decision. And in this video, I'm going to explain what those factors are in simple language without any medical jargon for anyone who's recently been told that your arteries are blocked and are confused about what comes next. When doctors decide how to treat blocked arteries, they're usually looking at three things. Number one, the patient's arterial blockage pattern. For example, how many arteries are blocked, which arteries are involved, whether the blockage is spread over a stretch of the artery or involve multiple branches or segments of the artery, are they heavily calcified? Each of these situations poses its own set of challenges. And this matters because there are some blockage patterns which don't respond well to simpler treatments like medicine or stents and may require approaches which reduce the risk of the problem coming right back. Second, the patient's existing risk factors. For example, diabetes, kidney health, smoking history, and how strong the patient's heart muscle is. Each of these factors influences treatment risk and recovery, and how well the patient's heart tolerates both. For example, diabetes increases chances of complications, and a low LVEF, left ventricle ejection fraction, which means the heart is not pumping as strongly as it should, can increase surgical risk and recovery complications. And third and finally, the treatment approach. There are three medically acceptable ways to address blocked arteries, and the choice affects risk, recovery, how long before the problem returns, and chances of repeat procedures being required over time. The first approach is medical therapy, where carefully monitored medication along with lifestyle management may be adequate or appropriate for certain patients depending on the patient's risk, symptoms, and the patient's comfort level. Approach 2 is intervention. Blocked arteries are treated with catheter-based procedures such as angioplasty, usually with stents and usually when one or two blockages are suitable for this technique. Approach 3 is surgery. Bypass surgery is associated with better long-term outcomes for patients with specific arterial blockage patterns. A quick recap. 3 factors affect how blocked arteries are treated: the patient's arterial blockage pattern, the patient's existing risk factors, and the best suited treatment approach for the patient, which could be medication, stents, or surgery. In the next video, we'll take a closer look at each of these 3 approaches, what they offer, what they do not offer, what kind of patient is suitable for each approach, and why outcomes may not be identical for 2 different patients even though they undergo the same procedure. Take care.